Basically, this will tell you what to do if you're in the situation where there's someone who is exsanguinating, bleeding to death, or if you're ever in a situation where there's a mass shooting or a blast or something like that. And that's what the point of this is, to teach the public what to do. Okay, if you're in a horrible situation like that. I mean, it could be with one person also if they just cut their artery by accident, but if you're in a situation where there's numerous injuries, what the public can do. So, and I'll go through it kind of quick, but the numerous national committees are a part of this campaign. The focus of it is to teach the public an immediate response to patients who are bleeding, recognize what life-threatening bleeding is, and find the appropriate ways to stop bleeding. With the right training, the public can save someone's life, for sure. So I got rid of the most graphic images. If anyone's extremely squeamish, then maybe you don't want to watch this. There's nothing horrible in there. Well, I take it back. If you're squeamish, then don't watch. Disclaimer. Okay. So let me just ask people this: how many liters of blood does a human being have?
8.
8, 6, 5. 5 to 5.5 is the answer. Okay. How much can you lose before you die?
2.
2. Good. So more than, very good.
That's my first responder.
That's your first responder training, right?
Memory.
Okay. If in situations that have happened, the Boston Marathon bombing, terrorist attacks, things like that, there have been situations where patients are exsanguinating and their lives are saved by a tourniquet. Now, you can, if you cut an artery, the person can die within a few minutes. The bystander can if they put a tourniquet on and put direct pressure, can save their life. So that's the point of this, is that if someone is bleeding rapidly and you see that they're going to lose 2 liters within a minute or two, unless something happens, the public is needed to stop the bleeding, and that's why they did the Stop the Bleed campaign, to put it out there. So why do we need this training? I mean, the obvious ones, mass shootings, bombings, but things like home injuries or work-related accidents can cause you to bleed also. Just think about those 2 liters. If you see someone that's at risk of losing 2 liters of blood, then you want to be able to do something to stop them from bleeding. The ABCs of immediate response. For those of you who have first responder training, you've probably heard this before. Go ahead.
Okay. If you happen upon a person lying on a sidewalk who may be tempted to try to help, because of legal reasons, should you try to help, or should you just call 911?
You should call 911 and help. There's Good Samaritan laws that basically protect everybody. This is, in my opinion, a myth that someone who's a Good Samaritan tries to help out an injured stranger can get sued. Okay, I've never heard of it. We've talked to our legal counsel about it. They've never heard of it, and it's pretty much a myth, and you're protected by Good Samaritan laws in New York State. Okay. Now, the first thing you do is call 911. Okay. Actually, the first thing you do is make sure that you're safe, that your scene is safe. You never want to become one of the victims. If you're in an active shooter situation, you want to extricate yourself from the situation first of all. Run away, okay, or hide if you have to. Once the scene is safe, and then you're alerting 911. Once 911 is alerted, if you already know that they're alerted, then you want to try to stop the bleeding. So that's what the B and the C of this are. You want to find the bleeding site, and you want to compress the bleeding, or use a tourniquet if you can. So again, make sure that you're safe. If you become injured, you'll also be the victim. Initiate care if the scene is safe for you to do so. If at any time your safety is threatened, remove yourself from danger. You're the first person to help yourself. And wear gloves if you can. So, again, call 911. What type of bleeding can be stopped by bystanders in the field? In other words?
Compound fracture?
Fracture, sure. Some body parts. If you have internal bleeding, if you have a gunshot to the abdomen, can a bystander stop the bleeding?
Usually not.
No.
Try to compress it.
But you compress it to try to control.
It doesn't do that much.
Okay.
If you have a gunshot wound or a stab wound or something to an extremity, can the bystander do something?
Yeah.
Yes, right? So, just recognizing what you can do. Extremities or torso
I'm
junctional.
sorry, if
Yeah.
a
a knife wound and a gunshot wound.
Well, they're very similar in what happens, right?
Let them,
Don't let them. You're calling the ambulance and making sure that.
okay, but there's nothing you could do, and you shouldn't pull out the.
Definitely do not. You do not pull out the knife, right?
Do not go.
You make sure that they stay still. If they only have a knife wound to the abdomen, let's say, then what you would do is calm them down, keep them still, and call 911. Have 911, bring them to the hospital, take them to the operating room, and open the area so they can cauterize bleeding sites inside. You cannot compress their entire abdomen and stop the bleeding. Okay?
Okay, and are you
Or
gonna
chest.
explain how to do the tourniquet?
Yes, that's the whole point of this. Yeah, I'm gonna get to that in a minute. So the areas where you can make a difference are the extremities and the torso-junctional areas. Did I answer that? Yeah. Bleeding. You find where the bleeding is coming from. Take clothing off. Look for a life-threatening wound. Remember the 2 liters? You find the wound that has the most bleeding coming out of it. Blood that won't stop if you put pressure on it. Blood that's pooling onto the ground. Clothing that's soaked. Bandages that are soaked. If there's a loss of a part of an arm or leg, it's going to bleed a ton. Okay, you need a tourniquet for that. And bleeding in a victim who's now showing signs of blood loss, which would be confusion, fainting, things like that. Questions? Okay, so the torso-junctional areas, we pointed to these, the neck, the shoulders, and the hips. Now the difference between these and the more distal parts of the extremities, the arms and legs, is that you can stop bleeding here with pressure, but you cannot put a tourniquet on. Okay, so if a patient has bleeding in their neck, you can't put a tourniquet around their neck, right? It'll kill them, right? In addition, if they have it in their shoulder, it would be very difficult to put a tourniquet on to stop the bleeding for that. That you can stop with direct pressure, but you can't stop with a tourniquet. Chest, abdomen injuries. Now those, hopefully not bothered by that. It's bothersome to see, but that's what gunshot wounds look like. They're just tiny little holes. Okay? You can't stop the bleeding with that. That kind of thing. If someone's shot with a gun and you see that, they have to go to the hospital and let's get there as fast as they can. So we'll leave that alone. Now, if you're at a site where there's bleeding and you don't have a first aid kit available, the first thing you do after making sure you're safe, alerting 911, is see if there's a first aid kit available. If there's not, the first thing you do is put direct pressure on. So most bleeding stops with direct pressure. Yes? Question?
I've seen people use sanitary napkins.
That'd be fine.
Yeah.
Towel, sanitary. You just want to put pressure on it first. The first thing you do, before you think about getting the tourniquet, everything else is towel and put as much,
Fresh ones.
a ton of pressure. I'm not just a little bit of like just dabbing it. You're not dabbing it. If you want to stop a bleeding site, you need to put a lot of pressure directly there.
Right.
It can be done with a finger. You can save someone's life with a finger. Okay, if they have a femoral artery that's hit or nicked, okay,
Plug it up.
plug it up. Right. You got it.
What happens
Yes.
if you have long nails? Do you do
Then worry about it
more-
later.
Do you do more damage than good?
I don't think so. I don't think so. I mean, you try not to use your long nail, but I mean, use your palm. Use your palm. You know. Yes.
What's an Israeli bandage and how is it used? Are you familiar with
Which bandage?
it? Israeli bandage? You're supposed to clot
Yes.
something?
We have I believe I have a slide upon that. So there's developed in Israel the medicated bandage that has clotting material on it. There's a lot of experience and evidence with it in combat situations that it's helpful. Now you might not have that available to you, probably won't, but if you do, then you would use that for direct pressure. Basically take that and then put direct pressure with that. It's still direct pressure. You're still compressing the bleeding site, but if you have what you call Israeli bandage or bandage that's medicated with clotting factors, you would use that.
Do they sell that here?
They sell it, yeah. It's not a prescription or banned or available to the public.
What is it called?
An Israeli.
There's a bunch of different brand names
It's
for it.
like clotting you want?
It causes clotting, yeah. Surgicel is one,
So it causes clotting.
causes clotting. You want to cause clotting, yeah. So direct pressure, whatever you can do to cause direct pressure is the first thing to do. So this, if you had a long sort of laceration like that was oozing blood out of it, you would first do direct pressure like that, right? As much as you can. Then you ask, is there a tourniquet available? Because the tourniquet is actually ends up being better than direct pressure.
Go back to the previous one,
The picture?
that had important things that we didn't get a chance to read.
Okay, sorry. Apply continuous pressure with both hands directly on top of the bleeding wounds. Press down as hard as you can and hold pressure until relieved by medical responders.
Thank you.
Person going into shock, head up or head down?
Head
Would
up.
you elevate the head with a towel or a pillow?
Right, you put the head up, yes.
Right,
Okay?
okay, thank you.
No problem. You can elevate the extremity that's bleeding,
Mhm.
okay? Because you want the,
Right, to go to the heart.
right. Okay, so tourniquet application. And I have some tourniquets here for whoever wants to stay. There's a mannequin, that big black thing I brought is tourniquets with mannequins. So whoever feels like practicing will practice. Okay. I'll show you quickly how to do it. You want to put the tourniquet above the bleeding site.
Mhm.
It maybe seem intuitive, but you want to be before it to stop the blood supply to the entire extremity. Basically, that's what tourniquet does, in case people don't know. The tourniquet stops blood supply to the entire extremity. So here's a good question. If you put a tourniquet on the entire leg, obviously the leg's not getting blood anymore, right? So it's at risk. How long can a tourniquet be on an extremity before the extremity starts to
You
get...
have to release it after a certain amount of time, 3 minutes,
No, I think that's 3 hours, no?
No.
less, 5 minutes, 3 minutes. to
We're
5
hearing
minutes.
some good answers.
10 minutes, 15, 20 minutes.
Extremities have been proven that they can survive for 2 hours without blood supply, okay?
You have to write the hour down next to it, right?
Right. The
2 hours.
idea of relieving and unrelieving and relieving and unrelieving is actually not supposed to do that.
Ah,
If you're a bystander and you tourniquet to stop a bleeding site, you leave it on, period. You leave it on until they go to the hospital.
That's right, and that's what
Okay.
the hospital.
You don't take it on and off.
they used to say, well,
No, it used to be.
They used to say things, they used to say, that, you know, there's no
because
evidence,
in my first responder, they said
Yeah.
that it had to be released after a while and then done again. But
That's changed.
That's already 25 years ago.
It's changed. There was a time actually when tourniquets had fallen completely out of favor, that they were not
Right.
used by paramedics at all.
Wow.
And actually there was a lot of the military evidence from Iraq and Afghanistan that showed that tourniquets are actually
Wow.
extremely useful. And so they came back into favor. Yes,
If you apply the tourniquet very firmly,
yes.
it cuts off the blood
Cuts
circulation.
off the blood supply.
So,
That's the reason for the...
so that part of the body can be up to 2 hours without
Yes.
blood?
Yes. It's different than your brain. The arm or the leg can go 2 hours without blood. Now, it's extremely painful and uncomfortable, right? We can put a tourniquet on ourselves later and you'll see how it hurts, right? But
Will the tourniquet cause clotting?
No. It'll stop the arteries from feeding blood into the extremity where the patient is exsanguinating from. Yeah. Okay. So 2 hours we have. We don't take it off, we just put it on and wait till the ambulance takes it to the hospital. Now, if you're in a situation where there's no hospitals around, you know, this is a different situation. But this training is basically for bystanders in an area where EMS exists, where there's hospitals, right? So put it on and leave it on. Okay, I'm not, if you're in the middle of the wilderness and there's no doctors around, this is a different story, right? Okay. But this is for situations where the patient is going to go to the hospital, you just put it on and leave it on. And they have up to 2 hours, so you don't have to worry about taking it on and off. That's a successful tourniquet. Apply immediately if life-threatening bleeding is seen. 2 or 3 inches above the wound, so you want to be before it. Put direct pressure first and then the tourniquet, and do it until bleeding stops. Now there's new tourniquets that exist now. They're not. There used to be these yellow rubber or blue rubber bands. They're not nearly as good as the ones they have now. These are also military-grade tourniquets that are available in kits, and I have some here you can look at. And eventually, the idea of the Stop the Bleed campaign is that these are going to be put in airports and malls and stuff like that. And that's sort of the goal of this. If you know that what automatic defibrillators are, they exist now in malls and in airports and airplanes. They want to put tourniquets also in those places, so that if there's a situation that people will have them, take them, use them, stop the bleeding before they get to the hospital. That's sort of the point of it. And those will be, in the next few years, the one on the far right, which is the emergency and military tourniquet. Okay? So basically, it has this clasp, you twist around and then strap, and that's how it works. You put it on first, tighten. Make sure you remove all slack. And here the bend to the extremity. Twist. Twist until there's no more pulse in the extremity and no more bleeding. And then clamp it down. And that's basically what you do. If you get good at it, it takes a matter of seconds. And you write the time down, like someone said. So the key points. Using one of the recommended tourniquets is safe. You have 2 hours for the blood, without blood supply. It can save their life. If need be, and it's not as good, use a homemade tourniquet. If bleeding is not stopped with one tourniquet, you can put a second tourniquet on. No amputations. You put another one on an inch before it. Also in the same extremity. You can do 2. No amputations have been caused by a tourniquet when left in place for less than 2 hours. So there's data. It's never happened before. They don't get necrosis of their tissue being less than 2 hours. Better to risk a damage to the arm extremity anyway, arm or leg, than to have the victim bleed to death, right? And training tourniquets should not be used during a real patient incident. That's just if the one that we practice with the kid is not used on the ambulance, so we'll skip that part. Tourniquets hurt a lot. That doesn't mean you did it right. In fact, it should hurt when you put it on. Unfortunately, that's what you have to do to stop the bleeding. And the paramedics and the medical system will deal with the rest of it. Your job, if you're ever in a situation where you have someone who's exsanguinating, is direct pressure and tourniquet. And that's it. We'll just stop the bleed. That's what you can do. That's what the bystander can do to make a difference, to stop the bleeding. Okay? Common mistakes: not using a tourniquet or waiting too long to apply one. You watch and wait. Do I need to? Do I not need to? If it's bleeding, you put it on. Not making the tourniquet tight enough. Not using a second tourniquet if needed. Periodic loosening is bad. Do not loosen. And removing a tourniquet by a bystander should only be done by really the physician. Any questions about stop the bleed? All right. So hopefully you can spread the word and feel a little more empowered if you're ever in a situation like that, to know basically what the bystander can do in this stop the bleed. Okay.
Thank you.
No problem. All right. Lot of good help.
Johnathan, proceed. Thank you to the left.
Whoever wants to stay, I'll take out the mannequin and we can put the